Step into any of Parkway Health's hospitals in Singapore, and you will discover that quality healthcare means more than medical care. Parkway Health offers accessibility of specialized medical procedures, quality of personalized care, and treatment at its 3 well-established hospitals: Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital. At Parkway Health, quality healthcare is about total patient's experience. It is also about tender, loving care at every touchpoint in any of its hospitals. Our reputation for excellence has not gone unnoticed. Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital are Joint Commission International accredited, demonstrating our commitment to quality, safe, and efficient patient care. Recognized worldwide as one of the leading healthcare providers, Parkway Health has a pool of experienced medical specialists, invests in medical technology, and the right infrastructure to provide value-based integrated healthcare. Parkway Health offers clinical programs that are tailored for patients to experience holistic and comprehensive care under a team of specialists. With more than 1,200 accredited specialists covering over 40 multidisciplinary specialties, patients can expect quality care and be assured of our integrated facilities and expertise, which are grounded in good clinical practice. Whether patients' needs are basic or complex, they find reassurance in Parkway Health's facilities. To achieve quality clinical outcomes and for effective treatments, Parkway Health continues to invest heavily in proven and advanced medical technologies. Parkway Health also extends round-the-clock medical service through its 24-hour accident and emergency facility, providing care for life-threatening emergencies and minor urgent care medical problems. Parkway Health operates a patient assistance center to serve as a one-stop and 24-hour service center to help patients access specialists and complex medical care in Singapore. 24 hours a day and 365 days a year, our helpline service provides medical referral and assistance in over 10 languages. Our global culture means we know and understand our patients from their perspective. People from all over the globe have come to Parkway Health's 3 hospitals in Singapore for comprehensive specialist care. Beyond its reputation for medical milestones, patients come for the peace of mind, knowing they will receive quality care by our dedicated team of nurses, doctors, and staff who understand their special needs. In realizing our vision, we seek towards achieving quality clinical service and operational outcomes. This way, when our patients step out of our hospitals, we know we have made a difference in their lives. Parkway Health, your quality healthcare provider in Singapore.
Hi viewers, welcome to the health show Doctor's Voice. This is Dr. Nova along with you in world famous Parkway Cancer Centre, Mount Elizabeth Hospital, Singapore. We are here to keep you in good health. We are very happy to have Dr. Freddy Teo, Senior Consultant Haematology, Parkway Cancer Centre. Now we will talk to him. Hi, how are you?
I'm fine, thank you.
Greetings from SATV Bangladesh.
Thank you.
We will talk about blood cancer.
Yes.
And you are a hematologist. And I want to know from you that what are the causes of blood cancer?
Most of the time, we do not really know the exact cause for blood cancer in one particular patient. But in general, the usual culprits, the usual reasons why people may be more prone to blood cancers are if there's exposure to radiation, if there's exposure to a lot of chemicals, sometimes age factor itself. As we grow older, blood cancers are more common. These are the three main reasons why blood cancers like leukemias and lymphomas can happen.
What is leukemia and lymphoma?
Leukemia is a blood cancer of the marrow. The marrow produces white cells, red cells, and platelets. Sometimes some of these cells become cancerous. There's a change in the genes, and these cells do not follow instructions. They just keep overproducing themselves. That leads to cancer of the bone marrow. Lymphoma is cancer of the lymph glands. It's the same thing. All of us have got lymph glands. These are normal cells that help us to fight infections. But they can also turn bad if there's a change in the genes, and then they can become cancerous.
And how will we know that this is cancer, and at what stage people will go to a doctor?
Okay, if we talk about leukemia, there are many types of leukemia, but generally we divide them into acute leukemias and chronic leukemias. The acute leukemias, they usually present to the doctor because of frequent infections. Sometimes they are very tired because the red cells are low. Sometimes they present to doctors with bleeding problems if the platelets are low. For example, blue blacks, nose bleeding, gum bleeding. Because the platelets are low, then they will go and see a doctor. And usually we will need to do a blood test. Then from the blood test, it should be quite easy to make a diagnosis of leukemia. Lymphomas are a little bit different. Their presentation is usually with enlarged lymph glands. Sometimes in the neck, sometimes in the armpits, sometimes it could be in the chest. And what will happen is these lymph nodes can press onto the airways or the heart, then they will present with breathlessness. Most of the time, you need to have a biopsy to confirm a diagnosis of leukemia or lymphoma. For leukemia, the biopsy, the best test is the bone marrow examination. Doing the biopsy of the bone marrow, we can confirm the leukemia. We can then type and subtype the type of leukemias. It's the same with lymphomas. You have to do a biopsy of the lymph glands. First, you confirm it's lymphoma. Then you need to know which type of lymphoma it is and the subtype of lymphoma.
And people want to know that is it curable?
Oh yes. As long as it is a blood cancer, whether it's a lymphoma or leukemia, there's always a chance for cure. Because these two cancers, these two types of blood cancers are the more treatable type of cancers. With chemotherapy, with stem cell transplants, there is a good chance of a cure. So whenever we see a patient with leukemia or lymphoma, our first thought is this curable? Is this patient suitable for aggressive treatment for cure?
With your permission, now we will go for a short break.
Thank you.
Dear viewers, we will go for a short break. We'll be back soon. Please stay with us. Dear viewers, welcome back to the health show, Doctor's Voice. And if you start chemotherapy, then there are a lot of side effects and people are scared of side effects. How do you manage those?
Okay, in the bad old days, yes, I would say we would be frightened of the side effects. But in the bad old days, when I say bad old days, is in 1980s, 1970s. The chemotherapy is worse than the disease. Not now. There are lots of good medicines to control vomiting. There are lots of good medicines to prevent infections. There are lots of medicines that we can provide to the patient to combat these side effects. Yes, I will still concede that chemotherapy is still a strong treatment.
Right.
There will be some side effects, there's no question about it, but it's no longer the bad old days where people are half sick with the chemotherapy.
Right.
No, it's quite different these days. The key is to individualize the treatment for each patient so that you can reduce the side effects, let's say from 100% down to a bearable 20-30%.
Is there any provision for radiotherapy for particularly blood cancer?
Radiotherapy usually not so essential, not so crucial for blood cancers, because blood cancers generally is a systemic disease, it's whole body, whereas the radiotherapy is for one specific location. So we only use radiotherapy for very limited situations. Let's say if there's a lot of pain here, the radiotherapy may be useful to control the pain. Or if you want a quick reduction, if this is really swollen, it is pressing onto the airways, sometimes we may do radiotherapy. By and large, not so useful.
A couple of minutes back, you said that stem cell transplant and bone marrow transplant. What are those?
Okay. Stem cell transplant just means that we are using stem cells from bone marrow, cord blood, or peripheral blood. So it encompasses the three types of transplants. We started with bone marrow transplants in the 1960s. In that situation, the stem cells are harvested from the bone marrow. Nowadays, you can get stem cells from cord blood. Then you call it a cord blood stem cell transplant. You can also harvest stem cells from peripheral blood. Then that is called peripheral blood stem cell transplant. So as a general term, we will say this is stem cell transplant. Then if we know the exact location where we harvest the stem cells, then we will say this is bone marrow.
And what is the success rate?
That's a difficult question because it all depends on a few factors. The type of disease, whether this is relapse or whether this is the first remission, who is the donor, sibling transplant, sibling donor versus an unrelated donor, and the age of the patient. In general, we would say for leukemias, the cure rate is between 50 to 70%. But it can be as low as 20%. If it's a relapse case, it's a refractory leukemia. If this is a high-risk transplant, then it may be lower. But if it's a standard risk transplant, between 50 to 70% chance of a cure.
And who can donate? Relatives, parents, siblings?
Okay. The best donors are siblings, because for stem cell transplant, especially allogenic stem cell transplants, you need to match. You and your parents are only half match.
Okay.
You and your siblings have a chance to be fully matched. If you get from the public, what you call unrelated transplants, it's a little bit difficult to get a full match. So the best donors are actually brothers and sisters. You can, if your brothers and sisters don't match, yes, we can consider doing from parents. So like in China with the one-child family, there's no chance of a donor.
Yeah.
So in that situation, we will have to consider the parents. Even though it's half match, the risk is higher, but it's still better than nothing.
And what do you think about counseling for cancer patients?
That is so important. I'm so happy you asked that, because when a patient gets cancer, it's very frightening. They don't know what's going to happen. Everybody says that cancer will kill. So of course, when a patient gets the diagnosis of this is cancer, they all freak out. I have not seen a single patient who is not worried about it. Right? So counseling is very important. Number one, overcome the diagnosis, overcome the fear of the cancer. The patient and the family needs to know, is this cancer potentially curable or not? Blood cancers, as far as I'm concerned, every patient with blood cancer should have a chance of a cure. It all depends on how you treat. Okay, so my first step is always counseling, explaining the disease. Then a large part of our treatment process.
Not only treating the disease, also treating the person as a whole.
And family.
Yeah, and family.
You need, because this is not a one-man show, this is not a one-man treatment. You have to involve the patient. We have to work together as a team. Patient, doctor, nurses. We have to do, and sometimes we even involve counselors, sometimes we involve dietitians.
That's why it's called a multidisciplinary.
Correct, the holistic approach.
Multidisciplinary care.
Yes, it is. You see, with that, it makes the treatment process a lot easier, a lot better. And to me, I think that will give the better chance of the patient to get through the treatment. If the patient has to do it alone, has to go and find his own information, they will get very depressed and they may get all the wrong information.
Sometimes people believe in some superstitions, misconceptions. Do you know those?
It is very common here. The Chinese, which is the bulk of our patients.
In our country, superstitions and misconceptions, there are a lot of misconceptions.
Yes.
But would you please tell me about that?
It's the same here. We have a lot of local patients who would believe that you cannot discharge on Saturday, you cannot have treatment on these days. Now, if all these superstitions does not harm the patient, does not interrupt the treatment, I would say carry on. You do not want to have the treatment on a Saturday, it's okay, because we can do on a Sunday, we can do on a Friday. Okay? But if the patient were to say, look, I want to have this treatment, a Chinese medicine that we know may cause trouble, then I would say, look, why don't we finish our treatment first? Because if our treatment gives you a good chance of a cure, don't change that formula first. Don't interrupt it with the Chinese medicine. So as far as all these myths, superstitions and alternative therapies, my principle is, does it interfere with the curative process? Is it going to lessen the chance of a cure for the patient? If it is, then don't do it first. But if it does not, if it doesn't harm the patient, if we are supposed to have the chemotherapy wearing this funny hat, then by all means go ahead. Because if it doesn't harm the patient, if it doesn't lessen the chance of a cure, it's okay.
In our country, there is alternative medicine that is practiced, but here, is it available here?
It is easily available, whether it's alternative therapy with traditional Chinese medicine, with herbal medicines, and sometimes even Western medicines. They also have alternative therapies, like use of mega doses of vitamin C, injections of vitamin B17, ozone therapy. There are many of such things available. Many of our patients may do it even without informing us. But I always encourage them, let's keep an open mind. You must tell me what you're taking. I will tell you whether it is safe or not safe to do it.
With your permission, now we will go for a short break.
Thank you.
Dear viewers, we will go for a short break. We'll be back soon. Please stay with us. Dear viewers, welcome back to the health show, Doctor's Voice. In our country, there is practice of alternative therapy. Is it available in Singapore?
It is an interesting question because a lot of patients will look for alternative therapies. Now, some are not to be taken, but at the same time, I would say we as doctors should try to be as open-minded as possible. If my treatment is curative, if there's a very good chance of a cure, I will always advise my patients, don't try these alternative therapies first. The reason, we must not we must not have any treatment that will affect the chance of a cure. But if this patient has got a very bad disease, is refractory to all our treatments, then by all means, because you will never know whether the alternative therapy may work. So keep an open mind. But if the treatment is highly curative, then don't try anything first. It's very common here that a lot of our patients will, by hook or by crook, get some traditional Chinese medicine, some herbal medicine. Some may even go overseas for IV vitamin C, macadoses, IV B12, and IV ozone therapy. That's very common in this part of the world too.
You told about stem cell transplantation, and is it very costly, very expensive?
Yes, unfortunately, stem cell transplant is expensive. Now, to give you a comparison, if you were to go to America for a stem cell transplant, a standard risk stem cell transplant is about $500,000 USD to about 800 million USD. Here, our usual range will be between 200 to 300 Sing dollars, 200 to 300,000 Sing dollars for standard risk. We are still much cheaper than in America or in Europe. The reason why it's expensive is patients need to be in hospital. And of course, sometimes that increases the cost of a transplant.
And what is the outcome of a stem cell transplant?
The chance of whether you can get a cure depends on a few factors, the type of disease, the type of donor, the age of the patient, and whether the patient has got many comorbidities like heart problems or kidney problems or liver problems. So usually we will categorize into what we call a standard risk and a high risk group. In a standard risk group, the chance of a cure with a stem cell transplant can range between 50 to 70%. Because a high risk transplant, the chance of a cure may be between 20 to 40%. So there is a big difference whether it's a high risk transplant versus a standard risk transplant.
We came to know many information from you, a lot of information you have provided to us, and thank you for your valuable time.
Thank you.
Dear viewers, now we are at the end of the show. See you in the next episode. Till then, stay well and keep your eyes on ACTV. Take care, all the best.
This hospital will raise the bar in terms of the delivery of private healthcare standards to its highest form.
Anything you can think of, you have the best of the best working in this hospital.
Patients deserve the best of technology and the best medical care.
It's a very beautiful place.
I'm Dr. Tan Seeling. I'm the Group Chief Executive Officer and Managing Director of Parkway Pantai Limited, the holding company that built this hospital. I believe that this hospital would put Singapore on the world map. We've invested in state-of-the-art technology, medical equipment, and the entire hospital is built centered around the patient as our main focus.
I think being a patient at the hospital is really an experience for all the senses. I feel really at ease here. There are a lot of green spaces around the hospital which my family and I can relax in, and it really cheers a patient up to have sunlight streaming through the windows and you can't even feel the heat.
We believe that the healing of a patient's illness itself is a very holistic process, and we hope that this becomes an oasis of healing, an oasis of calm. So while we put in the best medical equipment, we have the best doctors and nurses taking care of the patient, we also believe in using the environment, making it a very, very comfortable, private environment for the patients to recover. The team spent no effort in scouring the world to find out what is going to be cutting edge and what is the future that's in store in terms of medicine.
The advanced technology that is available at Mount Elizabeth Novena represents what state-of-the-art medical technology We've got a state-of-the-art operating microscope that allows us to see beyond the surgical field, and that's critical for minimally invasive keyhole surgery. We've got the ability to check our work and ensure that we get the best results possible.
Some of the cutting-edge equipment that we have ranges from imaging equipment like the Biograph MMR. We can get very clear, detailed images onto the activity of the parts in the body without the risk of course, radiation.
The list of firsts at Mount Elizabeth Novena is really impressive, and this includes some lead-lined rooms which we use for patients with thyroid cancer, and we use them to actually give them radioactive therapy. And we're actually the first private hospital in the region to have them.
We've got a platform from an IT end that allows us to retrieve information, link up information, present data.
The beauty of electronic medical records is that we can access the records from any part of the hospital, anytime, without fail. And quick access means for faster, more efficient care for our patients.
We use the pneumatic tube system to send samples to the laboratory for quick testing so that the doctors can access the results almost immediately.
The laboratory support is really impressive. Patients can actually have their blood tests taken and expect their results back in as short as 2 hours. And this means that even international patients can fly in, have the test done, and expect to be home maybe within the same day.
This all translates to shorter operating time, better clinical results, and of course we've got a brand new ICU here, thoughtfully designed, capable of looking after complex and difficult and very ill patients, and which is really what we want, because the patients deserve the best of technology and the best medical care.
There are 250 medical suites in this building, and we have specialists ranging from neurosurgery, cardiovascular, anything you can think of. You have the best of the best working in this hospital.
The clinics are actually linked to the wards on every floor, and this is really important for us because it allows us access to our patients in the wards at all times and enables us to keep a really close watch on them while they're recovering.
What's really impressive is that access to advanced medical treatment can be done within 48 hours. A simple weekend away for medical treatment is now a real possibility within my busy schedule, and that's life-changing.
The staff, they're really warm and professional, and they always greet you with a smile. That's fantastic.
This hospital is really on top of technology, and I particularly like the other touches of technology that kind of completes the experience. There's Wi-Fi everywhere, and I can keep in touch with my family and stay online. And the patient console is a unique and nice feature that keeps everything within reach, like ordering food and of course selecting entertainment channels.
I've been a professional chef for the past 20 years. We have catered to many events and many products, but it's the first time I'm doing an opening for a hospital that position themselves 6-star. We have a cross-cultural menu that includes a symphony of cuisine and different cooking techniques as well as variety on the menu. We believe that by offering this kind of variety is sort of an excitement for the clients, that there will be something that they definitely want to look forward to for tomorrow's meal or the meal that's coming after.
No effort is spared in making sure that patient privacy, patient comfort and patient safety is not compromised in any way.
I like the garden very much, and the fountains and flowers. It's a very beautiful place.
A hospital that harmonizes the best technology with nature. It's possible.
The best of medical specialty under one roof. It's possible.
An exceptional team with extraordinary touch. It's possible.
A 5-star hospital cuisine is possible.
Care, comfort, and complete privacy. It's possible.
The hospital of tomorrow, here today. It's possible.
Service quality and speed with a human touch. It's possible.
Revolutionizing and setting a new paradigm in private healthcare. It is possible.